Yes, I want to talk about hormones. You might wonder why, and I'll tell you. I was on the tube yesterday, and there were all sorts of adverts on the tube. This is all around the London tube, saying things like, it's not him, it's his hormone, with some guy looking there completely fatigued and exhausted on on this advert in the tube. Another one says, men can get hormonal too. And I thought, this is very interesting. And then, surprise, surprise, the Sunday Times has a piece today. Men, are you hormonal? The wellness industry is coming for the boys. It says this: last spring, Jack Tyndall started to worry about feeling tired. I wasn't recovering from the gym as quickly, and I felt achy when I woke up, he says. I wanted to know if that was a normal part of getting older or something biological I could fix. He kept seeing advertisements online for testosterone deficiency, so he decided to click through and order an online test. The results suggested he had very low levels of testosterone. Before he had a chance to decide what to do, the clinic had tested him and started to send regular emails headed, "Let's discuss your low testosterone results." Inside were before and after photos from patients talking about how TRT, testosterone replacement therapy, had helped him lose body fat and gain muscle, and offers to prescribe testosterone cream, gel or jabs to Tyndall at a cost of £70 to £120 a month. I ended up feeling like I couldn't trust them because they were so pushy, he says. Instead of signing up, he made an appointment with his GP and got a referral to an NHS endocrinologist. And my friends, we've got a referral to an NHS endocrinologist too, one of the best in the business. I speak, of course, of Dr Saira Hameed, endocrinologist and author of Signals, the inside story of our hormones. And I'm just going to hold up this book to the camera here. I've just started this book. It's really fascinating. She's a consultant endocrinologist at Imperial College, Healthcare NHS Trust, and senior tutor and honorary clinical senior lecturer at Imperial College. Saira, thank you very much for being here. Firstly, I should say that since we last met at the Natural History Museum at a friend of ours' wedding, and you told me you were writing this book, I was very excited. So excited, in fact, that yesterday I started reading your book, and I was in a homemade pasta restaurant in Pinner last night reading this, getting rather some strange looks from people around me in the restaurant. But it's a very important topic.
Well, Ali, good afternoon. Thank you for the invitation. It's so lovely to see you again. Thank you for asking me to come on, talk about hormones. And what I think is absolutely brilliant is that you are reading a book about hormones.
Yes.
Right? Because it dispels maybe the commonly held view, which is incorrect, that hormones are something to do with women and women's problems and women's issues, right? When in fact, right now, you're hormonal, I'm hormonal, right? Being hormonal means we are alive. And if we weren't hormonal, we wouldn't be able to sit here having this chat.
I was told I was hormonal this morning before my show, and I took it rather personally.
No, you shouldn't. And you're going to, a spoiler for your listeners, you're going to reach a point in the book where you realise that if somebody thinks you're hormonal or you think you're hormonal, that is the ultimate accolade, okay? Because
Really?
our hormones kind of keep us alive, essentially. So much of our lived experience is being hormonal, and that, we shouldn't use that in a pejorative sense, right? The idea being hormonal means you're moody or puffy or grumpy or tired, but actually being hormonal is really to be a human being.
Now, let's take it back right to the start, if you don't mind, Saira. Can you just explain what a hormone is?
I want you to think of a hormone as being like a text message in your body, right? You have 30 trillion cells in your body, and they need to be able to talk to each other so they are all doing the right thing at the right time.
Right.
Okay? So rather than just being a being of 30 trillion cells, you need to be an interconnected human body that communicates with itself.
Yes.
Okay? So hormones are the body's internal messaging system that allow the body to do the right thing at the right time. And hormones are produced by glands. Think of the thyroid gland,
Yes,
adrenal glands, and so on.
Yep.
And the glands are like the transmitters, and they transmit these hormone messages. The hormones are carried in the bloodstream to a distant part of the body to communicate information. And that information then usually comes with an instruction or a command that another part of the body needs to do what it is told. And the most incredible thing about all of this is we don't have to do anything, right? We don't think about this, right? When's the last time before you saw the tube advert that you thought about your hormones?
I didn't think about them at all.
Exactly, right?
That's why it was a bit of a surprise to see it.
It is such a perfect system and a perfectly calibrated system. I do not think that Apple or Tesla could come up with anything this sophisticated, this elegant.
This is fascinating. How many hormones and types of hormones are there?
Oh, what a good question. So the ones I cover in the book, I cover about, 10 hormones. So it's usually like one hormone per chapter.
Right.
But there are many more hormones than that. And actually, we're discovering new ones all the time.
Yes.
So there are the biggies that lots of your listeners will have heard of. Things like cortisol, testosterone you mentioned,
yes.
estrogen, insulin. So these are the ones that tend to be in the public consciousness. But there are many others that are also just doing their uncelebrated number, giving you energy, making you hungry, making you feel full, right? Giving you really everything you need to glide through your day. And they're so silent and so stealthy. It's a bit like gravity, Ali. When did you last think about gravity? Well, I'm glad gravity's keeping me sitting in my chair, not floating around the studio.
Indeed.
Right? Your hormones are like that. They're so fundamental to life that you don't really ever notice them.
This is fascinating. Why are they important for us to be aware of, Saira? What's the point of it all? If they're all doing this stuff automatically anyway, what's the purpose of us being aware of our
So
hormones?
the awareness, I think, comes about because our hormones can go wrong. Right? Like the poster you saw on the tube.
Yes.
Okay. So that's where I come in as an endocrinologist. So endocrinology is the specialty of seeing people whose hormones are misfiring for some reason and then recalibrating those hormones back to the natural equilibrium, natural set point, and then somebody tends to feel better. So the awareness, right, comes from this, that so many symptoms of hormone dysfunction are also the symptoms of life in general. Bit tired, putting on weight, libido going through a fallow patch. Well, is that pathology or is that just the wear and tear of life?
Yes.
Okay. And so sometimes if that persists or something inside you says, no, this isn't right. This isn't just, I'm not just tired because I sort of stay up and infinity scroll and everything else. Actually, I think something's going on. Well, then the knowledge will give you maybe the impetus to go and see somebody and get some tests done.
Now, I should ask my listeners to call in with anything you want to ask about hormones, learn about hormones, share about hormones. And I want to ask you this rather provocative question, forgive me. How do you stop hormones ruling your life? How do you stop hormones ruling your life? 0345 6060 973, text 84850. So you've talked about some of the top of the pops of hormones. I mean, you've talked about estrogen, insulin, cortisol. There's also progesterone as well, and others as well. How do these things actually impact your mood and emotions?
Okay, well, probably the best way to look at it is to look how you feel when these hormones are going wrong.
Right.
Okay. So, for example, lots of your listeners may be in a phase that we call perimenopause, so that affects women in the years leading up to the menopause, or they may be going through the menopause at the moment.
Yes.
What is menopause? That is estrogen deficiency.
Right.
And that usually happens in your late 40s, early 50s. And some women go through that absolutely fine, right? They don't notice it, not an issue.
Yep.
But others will find they are anxious, they get hot flushes, they get insomnia, they might put on weight. And then we can use that as a paradigm to explain, well, what is this hormone doing when it's working well?
Right. And this is where you look at things like hormone replacement therapy?
Indeed. So hormone replacement therapy, we tend to think about estrogen and menopause, right? HRT.
Yes, HRT.
In fact, a lot of our specialty is, in fact, hormone replacement therapy because a lot of hormones can become underactive or deficient. And then we spend quite a lot of our working day replacing these hormones, right? When they are not present in the body or there's not enough of that hormone in the body. And the miraculous thing is people feel so much better, but you've got to make the diagnosis properly.
So this is fascinating because in the beginning of the book, which I found really interesting, because I must say, Saira, that having you on was a bit of a risk for me, because my mother might be listening and she's still disappointed I didn't become a doctor. But I'll have to deal with that later this evening. But the point is, you say that you didn't, when you were deciding your specialty, you didn't want to do things to people. You wanted to actually be more consultative in your approach to medicine.
Yeah.
So just explain that, because your job is a lot about asking the right questions, isn't it?
Yeah, absolutely.
Tell us a bit about that.
So medicine is broadly divided into what we call craft
Right.
and non-craft specialty. Craft means I do something to someone, okay? I do an operation.
Yes.
I do an endoscopy, right? And then there is the non-craft specialties, of which endocrinology is one, where we don't do things to people. But in fact, as you say, this is consultation-based.
Yes.
You essentially ask somebody to tell you their story, and you try to pull out from that story, are we talking about illness or are we talking about life? And
So
of course, there
interesting.
is a skill to that. So, I mean, when I was younger, and still now, actually, I absolutely loved Agatha Christie and detective stories. And actually, I spend so much of my working day being a detective, because people will tell you things, and sometimes it's just the lead you've been waiting for. They'll drop something into that consultation and you say, I know which way this is going. Other times they may say something that sounds really plausible, but actually you think, I think that's a red herring. Okay, so exactly like, Poirot and Miss
Yes.
Marple, that's what you're doing on the other side of the desk.
Can you give an example? Because there's one where I think there's a lady who comes in and she talks and she's totally, completely swamped and exhausted and tired. And then effectively the questions one can ask, I don't know, like, when's the last time you went on holiday? How much rest are you getting? Are you getting sunlight? All of these kinds of questions.
Your mother's right, you missed your calling.
I did actually want to be an infertility specialist at one point, because I turned up to the Lister Hospital in Chelsea and I shadowed a guy there, which I found fascinating. But then I did turn up in a three-piece suit with the FT under my arm, and he packed me off to the city, said I'd be much better there. So just give us an example or two of the kinds of things that people come in with, Saira.
Okay, so let's take that tiredness as an example, because lots of us are tired, right? How
Yes.
often do you ask a friend or a family member how you're doing? They say, I'm tired, I'm exhausted,
all the time.
Gotta get up and go. That in itself is not really enough, because
Right.
hormones very, very rarely just do one thing. So if you've got a hormone issue that's leading to your tiredness, there is going to be other evidence that needs to come to the table
Okay.
to consider that this may be a hormone issue. So the chapter you're talking about relates to cortisol.
Yes.
Right? And this patient had a very low cortisol level. So yes, she was exhausted.
Yeah.
But then when you just drill down a little bit, she had a low blood pressure.
Yes.
She's dizzy. She's losing weight. And then I don't want to give away like the big denouement here, but there is a sort of narrative reveal in that chapter where
Yes.
it's like, bam, this is not just about feeling knackered like we all do from
Yes.
time to time.
Yes.
So it's those are the things that you're looking out for in that history. A bit like, the detective is questioning you.
Well, it's interesting because one of your colleagues also said that they were feeling tired at the end of the morning, and you noticed that he went off to pray on a Friday, and you asked him, well, are you getting up to do your early morning prayers? And he said yes, and it was because he was reaching the end of the morning peak or something.
Indeed.
So he didn't need to have a medical intervention. He just needed to understand what was going on with his body.
Exactly right. And that's the importance, I think, of going through more of an expert route
Yes.
rather than thinking about more of sort of self-testing and
I
that
see.
sort of a thing, so that you don't go into these elephant traps. I
Yes.
think that's super, super important. So what you revealed there, Ali, was the details. And the details are never the details in a medical history. I always say they are the design.
That's so
Right.
fascinating,
So-
so fascinating. Right, let's get into this with our callers. My question to you is this: how do you stop hormones ruling your life? 0345 6060 973, text 84850. Anything you want to ask about hormones, how they're impacting you, your concerns about them, your awareness of them, your conversations you've had with endocrinologists yourself about them, anything you want to ask Saira about them. This is your chance. She's the author of this book, The Inside Story of Our Hormone Signals. It's going to be coming out in June the 4th. You can get it from good bookshops then, but she's here ahead of that just for your knowledge, pleasure and understanding. So get your calls in now. Anything you want to know about hormones, how do you stop hormones ruling your life? 0345 6060 973, text 84850. Ali Miraj in conversation with Dr Saira Hameed on hormones on LBC. It's 2:17.
This is LBC.
It's 2:19. I'm in conversation with Dr Saira Hameed, endocrinologist and author of Signals, the inside story of our hormones, out in the beginning of June. You should go and get it. She's with me here to discuss all your concerns and questions. I should say that she's not here to give medical advice. Because obviously, you know, she's going to be having a snapshot with you. She doesn't know your whole medical history, so just be mindful of that. But it's going to be a fascinating conversation. Are hormones, or how do you stop hormones ruling your life? 0345 6060 973, text 84850. Andrea in the Gower, good afternoon.
Good afternoon, Ali. Well, I'll answer your question. They completely ruled my life. There was not a thing I could do. I'm a 60-year-old woman, and I'm about 7 years post-menopause, and at about, I suppose, 4 years post-menopause, I completely crashed and burned. I was perimenopause, I went through the menopause. It was tough, but it was okay. But then I completely crashed and burned from like a mental health perspective. So I have never suffered from anxiety or panic attacks. I started to have anxiety, panic attacks, migraines, dizziness, sleeplessness, lost my confidence. And this was all really alien to me. And I thought I was through the menopause. So I didn't really... I didn't think it was anything to do with hormones. I thought that was finished and gone.
Yeah.
And I just thought, my God, there's something wrong with me. I don't know what's wrong with me. And I went to my GP and was really quite sadly let down by my GP. I think purely through lack of knowledge. It was suggested that I go on to antidepressants, and I said, no, I'm not going to go on antidepressants. Yeah, I know. I'm an incredibly fit woman. I train, I run.
Right.
So, you know, and I'm not on any other kinds of medication. And then I thought, I'm going to have to research this. I need to find out what's wrong with me. So I researched, and through my research, I was put onto a well-known menopause clinic and the podcasts that they did. And I listened to a podcast which was older women, mental health and the menopause. And I cried when I listened to it because it was me.
Okay.
It was absolutely me.
Okay.
So I ended up going to this clinic. It is a private clinic.
Yeah.
I'm now on hormone replacement therapy. I've been on it for about a year.
Okay.
So I'm on progesterone, estrogen, and I've only just very recently, after blood tests, been put on testosterone as well.
Okay, Andrea, hold it there for a second. Yeah, go on, just finish your point and I'm going to bring in Sarah. Go on.
And my question is,
go on.
For me, it's been absolutely horrendous. Particularly a few years post-menopause.
Okay.
I'm feeling much better now. So why is it that some women, as their female hormones deplete, their body copes, their head copes, they cope,
great question.
and people like me just crash and burn and the whole world comes tumbling down.
Thank you, Andrea. Sarah?
What a good question, Andrea. It's lovely to speak to you. And
you.
I feel like you've read an advanced copy of my book. Because you said 7 years. You said 7 years post-menopause, and I was in pieces. And actually, I do say in my book that the symptoms, in general, and this is not everyone, for some women it's longer than that, can last up to 7 years after the final menstrual period. So we define menopause as you haven't had a period for 12 months. But that doesn't mean that at that time point everything just sort of sorts itself out. So you've made such a strong point and actually, you know, really brought this to the fore. Lots of listeners might suddenly their ears prick up. They go, well, could that be me? And as Ali said, you know, if that is, you seek advice from your own health professional GP and so on. And it's such a stunning question. Why are some people, some women, more impacted than others? And I'm sorry for the anticlimax. We don't know.
Really?
Don't know why some women, you know, because what is menopause? We said a bit earlier, that's estrogen deficiency. Okay, your ovaries have stopped making estrogen. And why can some women pretty well sail through that, and other women, as you say, can have a really, really rough and difficult time? But one thing I would add, just for a bit of, frisson here, and again, it's in my book, why don't we know this? Okay, so we're talking about hormone deficiency that is going to affect 50% of the population, right? That's a given. So why don't we know the answer to your excellent question? Well, let me tell you this, Andrea, that only 2% of publicly funded research grants go to women's health.
How interesting.
2%.
Wow.
Okay.
Wow.
So we're not talking about a niche hormone condition that, 5 people in a million.
50% will be affected.
50% of women will go through this, and some women like you will be profoundly affected.
Gosh.
But the research, there is obviously research and some fantastic scientists working on these questions, but it is not a top-line question.
Wow.
I think it should be, but that's not the current situation.
Andrea, thank you so much for your observations and your story and your question. Appreciate it. Sally in Stourbridge. Good afternoon, Sally.
Oh, good afternoon, Ali. Thank you for taking my call.
Pleasure.
I'm 74, and 3 years ago I was diagnosed with severe ADHD.
Right.
And it made me look back over my life, and my school days made sense, my teenage made sense, my working life made sense, but it was all manageable until I had hormone estrogen-induced breast cancer. And the treatment for that was taking away as much estrogen as you possibly could do with the tablets. And all my ADHD symptoms went berserk. Now, I didn't know that then. It's looking back.
Yeah.
So do we know if there's any link between estrogen and ADHD?
Tyra.
Sally, lovely to speak to you. We don't actually. Well, I say we. Let me take that on. I don't. Perhaps there's something out there, but it's not something that I have come across. Perhaps if we broaden out your question and you shared with us that you had estrogen suppression therapy as part of your breast cancer treatment, and I hope you're doing okay now. Yeah. I think what this shows us is the profound effect of hormones on the brain and how we feel about ourselves and our mood and our behaviour. So much of the time we go through life thinking if I just had a bit more willpower, we think about agency, we think about moral fibre and all these sorts of things. But actually, so much of behaviour is the brain's biochemistry, and that's exactly what you're sharing with us. But the exact link that you've mentioned, that's not something actually that I know too much about.
Thank you very much indeed, Sally, for raising it. Alex, a new caller in Bromley. Alex, good afternoon.
Hi there, yeah, thanks for taking my call. Probably unusual to get a guy calling in.
No, it's important, Alex. This is why the adverts are all over the tube. We need to talk about it. Go on.
Fine, yeah, I've seen those too. Yeah, basically, I've been on TRT now for 9 years.
What's TRT, Alex?
Testosterone replacement therapy.
Right, okay, thank you.
And my symptoms started at the age of 30. I'm now 49.
Yeah.
And it was 10 years of a very slow progressive build-up of anxiety, depression, insomnia, lethargy, many symptoms. I couldn't put on muscle in the gym. My recovery was very slow. And my mental health declined over that 10-year period. I'd been to the doctors many times, couldn't find anything wrong with me until finally they decided to do a testosterone level check, and I came back at 5 nmol. Anyway,
what does that mean, Saira? Sorry, just Alex. What does 5 nmol mean?
That's very low.
That's very low. Carry on, Alex.
Yeah, it's very low. So you put me on the gel. I did a bit of research on the internet, saw my endocrinologist on the NHS, but decided to go private, and I have done ever since. And I want to thank my private doctor for getting my life back. I'm no longer depressed, anxiety, suicidal thoughts have gone, my energy's come back, my business life has gone from strength to strength, and I'm the person that I used to be. But I have a question for Saira.
Go on, please.
So, apart from the testosterone, part of my therapy is another hormone called HCG, human chorionic gonadotrophin. I've never really known, Saira, why this is necessary and what it's actually doing alongside the testosterone.
It's a good question. I mean, I think I'd preface my answer to say it's slightly unusual, Alex. And obviously, as Ali said at the top, I don't know your full medical history. So there's obviously a reason why your endocrinologist has elected to do that in addition to your testosterone. If we broaden the question out, essentially in health, testosterone is made by the testicles, and the testicles are in fact a gland.
Right.
Okay. Mm-hmm. But the testicles aren't just kind of doing their own number, right? We should think of glands as being like factories, and they are controlled by a foreman.
Right.
And actually, the foreman is your pituitary gland, which sits in your brain. And it's actually your testosterone production, or in health, testosterone production is actually run by the brain, sending a signal from the pituitary gland in the brain down to the testicles.
How interesting.
Sure.
HCG is a mimic, essentially, of one of those pituitary signals to the testicles. So based on first principles, Alex, and obviously I don't know the full background to your case,
Sure.
It may be used as some sort of rev up. It's like the foreman is giving, orders to increase production to the gland. But so as I say, I don't know the details of your case, but that's the sort of first principles physiology.
Fantastic. Really, really interesting. Alex, thank you very much indeed for your call. Really appreciate it. Joe says this: hello, my sister is 78 years old. She has had increasing facial hair all over her face and neck. Now she has sharp whiskers all over the male beard area. Why would this be? And should she seek medical advice, please? Sarah, just a quick thought on this.
Yeah, seek medical advice. I mean, let's not get her worried. And I'm saying this based on the very short vignette.
Yes.
That we know. Really important. This is obviously, she's 78. Yes, younger women can sometimes suffer with increased hair growth on the face. Sometimes that's to do with polycystic ovarian syndrome and other causes. At 78, I mean, I would say, at any age, obviously get it checked. But yes, please advise her. Please nudge her into getting a consult with her GP.
Thank you, Joe. We're having this fascinating conversation with Dr Saira Hameed here, endocrinologist, consultant endocrinologist and author of Signals, the Inside Story of Our Hormones. And my question to you is this: how do you stop hormones ruling your life? 0345 6060 973, text 84850. Saira is with us for the next half an hour as well, so get your calls in. You know what to do, and also you can text on 84850. You're listening to Ali Miraj in conversation with Dr Saira Hameed of Our Hormones. It's coming out in June. You can buy it in all good bookshops then. I'm having a fascinating conversation on how do you stop hormones ruling your life. Everything you want to ask about hormones, talk about hormones, your stories, everything, now's the time. 0345 6060 973, text 84850. Victoria, a first-time caller in Hemel Hempstead. Victoria, welcome.
Hello, it's so lovely to speak to both of you, and thank you for talking about this. So I've had a really positive experience with HRT, and after a couple of years of seeing 4 different GPs and being dismissed about the menopause, I eventually went privately and got estrogen, which has been amazing. I was worried about the link between breast cancer and taking estrogen and was told it was a myth. But my sister has recently been diagnosed with hormonal breast cancer and has basically been told not to take any estrogen at all. And I just wondered, is this link a myth or is it real, and should I be worried?
Sorry?
Yeah, it's a good question. It's not a myth. We do know that there are certain cancers that can be influenced by certain hormones. So for women, in some cases, it's the link between estrogen and breast cancer. For some men, it can be a link between testosterone and prostate cancer, for example. So it's not a myth, but I think it's important to say that decisions regarding starting estrogen should be made bearing in mind there might be a risk, but then, of course, going through the medical history and making a tailored, bespoke decision for you, for the patient sitting in front of you. In exactly the same way, yes, there is a link between testosterone and prostate cancer, but that discussion will be had. And as in any situation, a patient then understands the risks and benefits, and then if both doctor and patient are in agreement, then you go ahead. So you're absolutely right to raise this. It's an important point. And for many years, this really deterred women from coming forward because it wasn't a link or a risk, exactly the right words you've been using. People almost thought it was synonymous. If I go on HRT, I might get breast cancer. But actually, that stopped women coming forward. We've heard from callers very eloquently describing the misery of going through menopause without adequate hormone replacement. For some people, it can be devastating. So important to have that discussion, go through the medical history, look at the risks, look at the benefits, and then come to a safe conclusion with your doctor.
Thank you very much. Thanks, Victoria. Sandy, another new caller in Barnet. Sandy, welcome.
Hello, thank you for taking my call, Dr. Saira. Hello to both of you. I want to know why a 46-year-old woman had thyroid, half a butterfly being removed because of cancer. Since then, why so tired? Cortisol is fine, hormone is fine, iron is fine, but since then have no energy, after work sleeping on a settee, getting wave of tiredness. What could I be wrong, please?
Saira.
Well, it's a good question. So, Sandy, just to sort of fill everybody in, the thyroid is a gland that sits in your neck in front of your windpipe. And you've rightly described it as being butterfly-shaped. And if you think of a butterfly with its wings spread, what you've described, Sandy, is you said half of the thyroid was removed for thyroid cancer. So it's like cutting, cutting a butterfly in half, and so you're left with half a butterfly in your neck. The point of the thyroid gland is to produce thyroid hormone. Thyroid hormone is the metabolism hormone. Right. Metabolism gives us energy through the burning of the fuel that we eat. So you're asking, Sandy, if half the thyroid has been removed, why should someone be so exhausted afterwards? Well, the first thing we think about is the remaining thyroid sufficient to produce enough thyroid hormone, that there is enough thyroid hormone in the system that metabolism is running along as it should. Now, you said actually that's been checked and thyroid hormone levels seem to be okay.
On a thyroid tablet as well, and everything is fine. And she's got fatigue, always tiredness, but everything is fine, taking thyroid tablets every day, but there's no energy since then.
Okay. So you're saying that there wasn't sufficient gland left, so now this person is on thyroid hormone replacement therapy known as thyroxine, and they still don't feel well.
Yeah, that's right.
And actually, I think you're right. You've said other things have been checked: iron, cortisol level, various other things.
Everything is fine.
And so that's obviously incredibly important to look at, are there other causes? Because sometimes in endocrinology, we have this situation where you fix a hormone, you give some hormone replacement, let's say, and the person still doesn't feel well. Yeah. And then I think we sort of sometimes have, yes, there can be other medical reasons, and then sometimes it's a question of what else has gone on in life. You know, cancer diagnosis is incredibly frightening, it's emotionally exhausting and so on. So is something else playing a part? So all of these things should absolutely be discussed with the treating endocrinologist, the person who's giving the thyroxine, managing the thyroid cancer care. And yes, you should always just, even if on first test nothing's been found, and yes, you've broadened the search beyond the thyroid, but it's important to keep on being curious. The human body is obviously, you know, it just keeps on changing. And sometimes if you say, well, I had a test 6 months ago and it was okay, well, just keep on checking. Okay. So
anything you can eat or take tablets, vitamins to give you a little energy?
That's quite a broad question, and I think the answer is if things are okay on testing, there's not really a need to then supplement further. So most supplements won't do you much harm, just the things you sort of buy off the shelf or over the counter. But I think it's important not to let that detract from what is actually going on, what is the cause.
Okay, Sandy, thank you. Appreciate your call. Sam, another new caller in Chatham in Kent. Sam, good afternoon.
Hello, good afternoon. Thank you for taking my call.
Pleasure.
Hello. My question is, I've been on HRT for 3 to 4 years, pills and patches, but still having periods. Often I feel unmotivated and my joints ache terribly. I don't seem to be able to put the shoes on, but I'm incredibly fit. Sometimes I feel 70 and not 50. Is this normal when you're on HRT? I thought it was meant to stop these symptoms. And also, how long should I be on the HRT and how do I know when to stop it?
It's a very good question. Quite often women start HRT and the symptom that was troubling them that led to them starting HRT often, materially improves, whether that's hot flushes, anxiety, and so on. I think, as we said to Sandy, then it's important then to broaden the search, because if you are on the right HRT, then what else can be causing the aching joints? So I think that's an important question to ask. and take to your healthcare provider. How long to be on HRT is not, there's not a kind of, certain answer. And again, it comes down to an absolutely bespoke approach. Each woman getting a very tailored reply to that question. Some women feel, I only want to be on HRT to really get through the worst of the symptoms, and actually then after a few years, I'd be happy to come off it. Other women try to come off it and feel absolutely awful. And then in consultation, risks, benefits, all the things we've spoken about, decide to carry on. Most women will stop after a number of years because, they find it's okay to do so. And there can be some health risks of carrying on for too long. That said, those health risks are on a population basis, right? Trial basis. And you have to tailor that to the woman sitting across the desk from you, saying, I feel awful if I try to come off this treatment.
It's really like you're when you're saying you've got to look at the broader things, Saira. It's back to your detective thing, the Agatha Christie type issue here, because it's very, the body's a complicated entity, multiple things going on. Sam, thank you for your call, appreciated. Marie in Dungannon in Northern Ireland. Marie, did I get it right? Did I get it right, Marie?
No, it's Dungannon.
Oh, sorry, Marie. Dungannon, go ahead, go on.
Okay. Hello, Ali. Hello, Sarah. I'm just ringing about a relative, well, not a relative, a friend, family friend of ours, and she has been diagnosed with hyperthyroidism. She is just shy of 80. Has been is waiting for an operation to get the part of the thyroid taken away, but has had an awful lot of weight loss. She's actually down 2 stone in the last probably 3 months or so. She was also put on cinacalcate because she was making too much calcium, or the body was making too much calcium. And what I'd like to know is, while she's waiting for the phone call to say you can come in and get the operation done, is there anything we can do to help build her up? Because she's terrified that they won't take her whenever she is called for the operation, because she's down to 5 stone 12 the last time she was measured, and she has actually had a gastric bug in the meantime as well. So no appetite, belching all the time, is on 40 sips, but not really helping that much, trying to eat, but has no appetite at all.
Okay, Marie, thank you. Saira?
Can I ask you a question, Marie, which you may or may not know? Is your relative on a tablet to suppress the thyroid until such time she can have the operation?
Not that I know of. There isn't. So she's under the care of the endocrinologist, and the only thing they were concerned about was the over production of calcium.
Okay. I mean, if she's precipitously losing weight, which it sounds like she is, then it is a good question to ask, because quite often we would use a tablet to turn down the thyroid level as part of the preparation for the operation, because you're right, if things are still very florid, the surgeon and the anaesthetist may have concerns. So that's a question. And again, I'm not sort of offering medical advice, it's a sort of broad statement here. In terms of building someone up, protein is incredibly important, as much as she can manage. And it can be hard if you've got a poor appetite, having an omelette or, having a steak or something might not feel very appetizing. So as much protein as somebody can manage is helpful for build up.
Yeah, she was given 40 sips, and I have made pudding with protein in it. Yeah.
And also, I think requesting from the specialist team, specialist dietitian input, I think is also useful in this scenario.
Yeah, it's just since the vomiting and diarrhea, her appetite has just gone downhill completely.
Yeah.
Marie, we hope we get you hope you get all the advice and all the help you need, and we wish your family friend very well with the future. Marie, thank you very much indeed. Anything you want to ask about hormones? You've still got 30 minutes to do so. How do you stop hormones ruling your life? 0345 6060 973. Text 84850. Ali Miraj in conversation with Dr Saira Hameed on LBC. It's 2:47. There's a piece out in the Sunday Times today. Men, are you hormonal? The wellness industry is coming for the boys. This was all triggered by the fact that I looked at an advert on the tube yesterday saying men can get hormonal too. It's not him, it's his hormones. Triggered a whole discussion in my head. And I've got a leading consultant endocrinologist, Dr Saira Hameed, with me in the studio, whose new book is going to be coming out in June, Signals, the inside story of our hormones. Really fascinating discussion we're having with all of you about hormones. How do you stop your hormones ruling your life? 0345 6060 973. Text 84850. Hibber, I'll come to your call in just a second. Just one observation from Tony, who's a new caller. Ali, very interesting topic. I found out that I had low testosterone and went down the natural supplement road. I'm taking ashwagandha and L-tyrosine, and I've never felt better. Stronger both mentally and physically. That's Tony in Montenegro. Tony, thank you very much indeed for your text. Hibbo, a first-time caller in Ilford. Hibbo, welcome.
Oh, hi. Thank you, Ali. Hi. I'm nervous. First-time caller.
Please go.
So the question I wanted to ask is, I'm 45 years old. I've had my child is 4 years old, my last baby, and then about a couple of years ago, I was having a irregular period. Then I went to my doctors and they did some tests, and they actually they were clearing pre-menopausal. And that was a couple of years ago. And then for 1 year now, 12 months, I haven't had a period. I just wanted to find out, I'm having night sweats. That's all I'm having as symptoms. I just want to know if that's I'm in the menopausal state, and how soon can I start the HRT?
What a good question. And Hibber, it's lovely to speak to you. Thank you for calling. And I think you make the really important point that at your age, you said you're 45, you absolutely can be perimenopausal, and you could have fully gone through the menopause. You said, I haven't had a period for over 12 months. Menopause is a clinical diagnosis. What does that mean? We don't need tests to diagnose it. If a woman says, I have not had a period in over 12 months, and there's no other medical explanation to say why that's the case, then that in of itself you can diagnose menopause. So yes, there are ancillary blood tests you can do to confirm that. And what I'd say to you, Hibbo, is go see your GP and discuss whether you need those tests. Can you start HRT? Obviously, this isn't directed at you because I'm not your doc, but, there is every possibility you could if you're symptomatic. And if you're having problems, as you said, sweats and other things, definitely a discussion to have with your doctor.
Thank you, Hibbo, for your call. Go on, finish your point, go on.
Yeah, so what was the test that you said I need to go and ask?
So you can do some blood tests which don't diagnose menopause, but back up your clinical diagnosis that the reason your periods have stopped is menopause rather than some other explanation.
Yeah. Hibbo, thank you very much. Appreciate it. Les in Glasgow. Les, good afternoon.
Hi there, thanks for taking my call, Ali and Saira. I have recently been diagnosed with a large pituitary gland tumour. I am waiting for a date to go in for surgery. Previously, several years back, I also had breast cancer, which was hormone receptive. I'm just wondering if you can advise if after I've had the operation, will my hormones spike in any way that would cause any kind of a other flare-up of the breast cancer, or will they kind of level back out again to where they seem to be at the moment? I haven't had any huge symptoms, which is why the doctor had explained that the tumour had managed to grow to the size that it has.
Well, it's a good question, Liz. Thank you. And I hope all goes really well with your operation. You mentioned the pituitary gland, and we've talked about it earlier, which is the pituitary gland, just for the listeners, is a gland in the brain that gives instructions to the body's other glands. And if you're and it's possible that gland can grow too large, which sounds like it's happened in your case, and so you need surgery to reduce the size of the gland. Now, what can happen after the operation, Liz, is that the ability of the gland to produce its requisite hormones is lost. Not always. Some people have the operation and the gland function is absolutely fine, but other times some hormone function can get lost after the operation. And then it's a case of your clinical team talking you through which hormones aren't now working well and which could be replaced based on, again, that risk-benefit discussion. So all might be absolutely well, Liz, but it might be that you need some hormones to be replaced. And in that case, obviously, they'll take into account that you're a breast cancer survivor and so on, and what should be replaced and what can be done safely. And I wish you the very, very best with that.
Absolutely, and same from me too as well, Liz. Best of luck. Gabby in Bushy. Gabby, good afternoon.
Hello?
Yes, Gabby, you're on it.
Hi, thank you.
Hi,
so my daughter is 4.5. She was diagnosed with Turner syndrome at 18 months old.
What is that, Gabby? Can you just explain?
Yeah, so it's a genetic syndrome, and it affects, I think, approximately 1 in 2,000 girls. And essentially, it's different, obviously, per child, but my daughter has what's called mosaic Turner syndrome. So partially she's missing, she has an additional X chromosome.
Okay.
And that has caused certain issues with her hormones. So overall, she will need to have HRT essentially when she kind of hits puberty age, because she has to have her ovaries removed as they were at risk of growing tumours. And so obviously the HRT will help, I guess, initiate that puberty. And yeah, sorry, I went on a tangent. But my question is, what can I expect, really, I guess, from my daughter going on HRT early?
That's a really good question, Gabby. Lovely to speak to you. So the way to think about it probably is that the hormones are going to be used at the correct age for your daughter in order to induce puberty. Mm-hmm. And that is a very, very carefully managed process with an expert pediatrician or a pediatric endocrinologist. Usually you would start on low doses, exactly as happens in natural or non-HRT induced puberty, and then it tends to be increased in dose as the child age increases. Now, it's a very bespoke process, and people respond very differently to different doses, and all of it will be very, very carefully managed and monitored. And fingers crossed, best case scenario, she has no side effects. She's having side effects, then obviously the team need to know about it. And actually, I think the aim would be for her to go through a sort of normal puberty just like her classmates.
Thank you, Gabby, for your call.
Thank you.
Thank you so
Gabby.
much. Keep well. Sarah, thank you so much. I mean, we could have gone on for another hour. We're going to have to get you back. We're going to have to get you back when the book comes back. When the book comes out, this book, Signals, the inside story of our hormones, is going to be out in June. We're going to have to get you back then, Sarah. Fascinating discussion.